Hi friends, welcome to FMT Guru. Welcome to discussion of forensic medicine question asked in your NEET PG 2025 August. How was your exam? The first question as usual, BNS are the acts related to medical practice. The question was about POCSO Act. The question was, under the protection of children from sexual offences, a child defined as any person. So, child or juvenile, male or female, less than 18 years. So, the best answer is, so male or female less than 18 years of age. So, A is the best answer. The second question, that is identification, the appearance of calcaneum, appearance of lower end of femur, upper end of tibia. So, very commonly asked in any entrance exam. The question, the talus develops from single primary ossification center in dash months of intrauterine life. So, the answer is viability. The viability is 28 weeks, that is 7 months. So, at 9 month lower end of femur, at 10 month upper end of tibia. Okay. C is the best answer. Then the question from asphyxial death. The very commonly asked topics are hanging, drowning, suffocation and strangulation. So, here was the question, that is throttling. Throttling means manual strangulation. So, in last year exam 6 penny bruises were asked, right. So, in case of asphyxial death, bruise were found at neck, bruise above the thyroid cartilage, the back and the scapular region, and there were scratch marks around the neck as well as face. No ligature mark given. So, no ligature mark given, so it is not a ligature strangulation. What is mugging? So, mugging basically constriction of neck at the elbow bend or knee bend. Garroting, that is a type of strangulation with a wire by using some ligature material without any warning, which is applied over the neck. So, the best answer is throttling. Throttling or manual strangulation, that is known as MS. And try to memorize 6 penny bruises, very commonly seen in case of throttling. Then as usual, the smell, very commonly asked. Last NEET PG, cadmium poison, thallium poison was asked. So, this year acute arsenic poison, garlicky smell. Garlicky smell is seen in case of arsenic poison as well as yellow phosphorus poisoning. So, the question the most probably asked, patient came with a history of unknown poisoning with a rice watery stool. So, rice watery stool, cholera, garlic smell, vomiting, all this go in favor of acute arsenic poison. What is the fatal dosage? 200 to 300 milligram. So, arsenic is known as king of all poison, aconite known as queen of all poison, and thallium is known as poisoner's poison. So, answer is A. Not the lead poison, plumbism, so are the acute lead poisoning that presents with the different scenario, not the rice water stool. Phosphorus poisoning, smoking stool syndrome. Zemalgota, no. So, the best answer acute arsenic. Then as usual, question from sexual offences. So, that is examination of victim of rape. So, last year that was informed refusal, and this year it is basically statutory rape. A 16-year-old girl was brought to medical legal examination by parents with a alleged history of intercourse by a male and the girl. The male age is around 25 and girl age is 16. On examination, signs of recent sexual intercourse was found. No injuries on the body, no signs of force. But here there is a consent is present. So, consent is there, and there is also will is also there, but consent is invalid here. So, there is a will, but the consent is invalid. Why? Because the age of the girl is than 18 years. So, there can be will, but the consent is invalid. So, what is the best answer? So, the best answer is inform police. Inform police as per section BNS 63-64 as well as POCSO Act. It is not rape as consent is given, no. Consent is valid, no. The patient cannot file the case, no. Best answer B is the correct answer. Here will is there but consent is not there. Will and consent both are not same, both are different. Next question, factory leakage fumes. Okay, there was a leak of toxic fumes from a factory. What would be the best next step? So best next step is wait for further instruction? No. Go out of house, inform others? No. Don't follow instruction? Definitely no. Close the door and window and seal the cracks. So that is the most appropriate step in this case. And again, one question basically from postmortem changes, especially supravital period. A supravital period is a period between a somatic death and a molecular death. So in supravital period, there are some tendon reflexes are present. Like example, Zarco phenomena. So what is Zarco phenomena? So Zarco phenomena is a tendon movements or the muscle response observed shortly after death. So A is the best answer. Increase in potassium level in vitreous? No. Fragmentation of blood, that is known as Kevorkian sign. Kevorkian sign. Collection of blood in dependent area, that is known as postmortem staining. So the best answer is A. Then the question from forensic psychiatry as usual. So delusion of persecution, 22 BNS, 84 IPC. The question was indirect question. So before that, you must know the burden of proof in case of 22 BNS, it is lies with the accused. Lies with the accused. Let's see what is the question asked. Assault and murder. Assault and murder was committed by a person with a alleged history of mental illness. He was suffering from delusion of persecution and hallucination. Voice told him to do that. And what is the next best step is? Release him as he is mentally ill? No. Psychiatric evaluation? Yes, it can be. Proceed with the trial? That is also correct. None, definitely not the answer. Now here, remember, according to 22 BNS, the burden of proving mental illness, it is present with the counsel of the defense counsel. So here, I'll go with the C more than B. As per 22 BNS or 84 IPC or criminal responsibility of insane person. Then as usual, true insanity, feigned insanity, okay, delusion, hallucination in schizophrenia. So here was the question. Young male comes to your OPD with a certain presentation. He says that when he sits down, he hears the bird wings flapping. He believes that. So basically, it is a disorder of thought. It must be delusion. So I'll go with delusional perception. That is the best answer than the hallucination. So the most common hallucination in schizophrenia is third person hallucination. So the most common delusion is delusion of persecution. So answer is B. Then the question, that is fat embolism. A 60-year-old with a history of road traffic accident with a multiple fracture involving femur and shortness of breath, confusion, shortness of breath. So petechial rash. So petechial rash when it is given. So this is basically a triad of fat embolism. So that is the best answer. So this is about the brief and short discussion of FMT question asked in your August 2025. So any new question or any other changes in the question, you can message me in the comment sections. So thank you and wish you all the best.